Simulation-based learning at Massachusetts General Hospital has become easily accessible to both trainees and practicing clinicians across professions, perhaps as accessible as a book on a library shelf used to be. Hi, I'm Jim Gordon. I'm director of the Learning Laboratory at Massachusetts General Hospital. The Learning Laboratory is a collaborative organization designed to support simulation-based teaching and learning across an entire hospital campus. In particular, we focus on opportunities for deliberate practice with peer review and feedback to improve performance across all domains of care at the hospital. The Learning Laboratory facilitates the quality and safety mission of Mass General Hospital alongside of its educational mission. It's an important part of the quality and safety imperative of a complex hospital and serves the entire community who is engaged in teaching and learning across the institution. It is both interdisciplinary and interprofessional. The Learning Lab's goal is to provide a unified platform for routine, deliberate practice and training in a very realistic environment, but one that is risk-free and allows teams and individuals to replicate their actual practice context. An additional goal of the laboratory is to infuse routine peer review and community practice into the everyday activities of the hospital. We provide services that are both centralized as part of the laboratory's suite of teaching and learning services, as well as distributed in situ or on location across different units of the hospital, even in intensive care units and operating rooms.
Hello, I'm Emily Hayden. I'm an emergency medicine physician here at Mass General Hospital. The Learning Laboratory is supported by staff from specialties including research, simulation, education, and technology. The Learning Laboratory is centrally located on MGH main campus. It is actually located in the former space of the Treadwell Library. The laboratory serves as a platform or forum for all individuals within the MGH community, as well as those outside of it, to practice in a repetitive way different skills such as procedural skills, team training, or clinical reasoning, all within contexts that are very similar to the actual clinical environment. One of the hopes or the goals of the Learning Laboratory is to provide an opportunity for all individuals within the MGH community to practice in a repetitive way, as well as have peer review, and have this infused into the daily clinical environment.
Hello, my name is Roy Fidiakon. I'm a general and endocrine surgeon here at Mass General Hospital. The In Situ operating room here at Mass General really gives us the chance to practice having nurses, anesthesiologists, and surgeons work together and really do some exciting research that we would not be able to do otherwise. This has improved access to learning for even the busiest professionals. The simulation operating room really gives teams a chance to practice interprofessional and complex technical skills in an environment that they're used to. We have developed an attendance tracking system that operates off of the ID badge swipe system so that we can accurately track which simulation sessions people have participated in and at what time and date they did it.
I'm Deborah Navedo, Education Specialist at MGH Learning Lab, and I'm faculty at the MGH Institute of Health Professions. This large educational enterprise requires a large, well-honed group of instructors. The instructor training and faculty development is central to our commitment to the educational mission, and we have helped to launch faculty development programs within departments and across the institution that offer both instructional modules online and in person, helping individuals to gain competence in the use of simulation and debriefing as educational tools.
I'm Ursnea Romo. I'm an anesthesiologist in the Department of Anesthesia, Critical Care, and Pain Medicine. I'm also a simulation fellow in the MGH Learning Lab. The Learning Lab's focus on faculty development is a vital component to our large academic medical center. For me personally, the Simulation Fellowship has been instrumental in my development as an educator with a focus in medical simulation. And through the Learning Lab, I've had plenty of opportunity to learn the theory behind medical education by taking courses at both the Harvard Macy program and the Center for Medical Simulation. Additionally, I've had plenty of opportunity to take these theories and apply them into everyday situations at both the medical school and the residency program.
Since the Learning Lab's inception in 2009, our offerings have continued to increase, such that we hope that routine practice for both clinical, communication, and technical skills, followed by expert debriefing, is becoming more and more routine as part of the hospital culture. We're very pleased that the Learning Laboratory can provide routine opportunities for deliberate practice and feedback in a risk-free environment to enhance the care of all of our patients. We're also delighted that the Learning Laboratory can serve as an effective bridge between the teaching and learning mission of the hospital and its quality and safety imperative.